Good morning, everybody. I'm Bob Hertel, the clinical educator at LNR USA. I'm based in Milwaukee, and I have the great privilege of introducing an old friend and colleague, Brandy McKeown. Brandy is the CEO of ILWTI, the International Lymphedema and Wound Training Institute. She has been certified for many years. I have even been to Tifton, Georgia, where she lives and practices. It's a beautiful place. She's nationally recognized, of course, which is why we're having her on here. She's a KOL, key opinion leader, has worked in many industries, many organizations within the industry, including the NLN, LANA, and so forth. Over 20 years of hands-on practicing, has worked in many different clinics and owned clinics in South Georgia, both in PT and OT, lymphedema and wound healing, which is a great combination to have. I would suggest that if you don't have some wound background, definitely look at ILWTI in the future, and a wealth of knowledge. So she is going to help lead us through the clinical documentation for the LTA. So with that, I'll hand it over to Brandy. Thanks.
All right. Thank you so much, Bob, for a wonderful invitation. And I'm excited to be here with you guys today. So how many of you guys look like this, right? Like, what in the world are we doing with this LTA? And what do you really want from me for my documentation in order to be able to make sure that my patient's going to qualify for these compression garments, compression devices, all of that kind of stuff, even those bandages, right? So how do we make sure that what we have in our clinical documentation is going to be appropriate, right? And that if that patient gets audited, or that DME company gets audited, is my documentation going to stand up to that audit to be able to make sure that that DME company gets paid for the compression garments and things that we ordered for that patient? All right. So first and foremost, the LTA very clearly states that there are 4 diagnosis codes that a patient must have in order to receive these eligible items from the LTA. So we have I-89.0, which is other lymphedema acquired. We have Q-82.0, which is primary lymphedema. I-97.2, which is post-mastectomy lymphedema syndrome. But you guys remember that that is also for those partial mastectomies and lumpectomies. You can also use that same code. All right. Make sure, though, that if you have a breast cancer patient who has not had any kind of surgery yet for that breast cancer, that you are going to actually use the I-89.0 code instead of the I-97.2. We also have another code for I-97.89, which is other post-surgical lymphedema. So that can be from any other cancer-related surgeries all the way down to our ortho surgeries and traumatic type surgeries and things like that as well, okay? Remember that when we are using these codes, yes, we do have to have this as our primary code when we're coding for these compression garments. But you guys make sure that we're also using some other codes with these that substantiate these codes, right? So if we have other lymphedema acquired, it's acquired. What caused it, right? So that we can better outline and describe through our coding what's going on with that patient. I always like to say that your coding can paint the picture of your patient if you're using the correct codes. So as clinicians, we need to make sure that we're putting in the codes that we know are affecting that lymphedema or causing that or triggering that lymphedema the most out of any of them. So definitely have to have these I-89.0, Q-82.0, I-97.2, and I-97.89 in order to even get started with any of this. So if you all are getting orders in for lymphedema treatment, but they're coming in as those edema codes, those R60.0s, things like that, we need to start sending those back, making sure that those orders are signed by physicians that have one of these 4 codes on them, just to even start this whole process, okay? All right, so what is covered under the LTA? So we know that that's custom and standard fit daytime garments, those custom and standard fit nighttime garments, off-the-shelf compression wraps with adjustable straps, also the custom of those wraps as well, all of our bandaging supplies, and then the accessories as well. So donning and doffing aids, paddings, liners, and zippers. So if this is standard Medicare, right, red, white, and blue card, we know that they are going to pay for 3 daytime garments every 6 months per affected body part, 2 nighttime garments every 2 years per affected body part, bandaging supplies, no set limit on those as of yet, and then accessories determined case by case depending on the needs of the patient. And just remember that the justification for the quantity of supplies needed and the frequency of replacement must be documented in the medical record, okay? So how many of these we need and how frequently we need them replaced must be documented in that record. All right, so if you all noticed, if you've read through any of the LTA stuff, LTA use the Johns Hopkins stages for lymphedema, which is 1 through 4. However, if you've been in the lymphedema realm for any length of time, you do notice that the majority of practitioners use the ISL stages of lymphedema. Therefore, if you are documenting and you're using the Johns Hopkins stages of 1 through 4, you need to make sure that you document that. But if you're using the ISL stages, you need to document that as well. The main thing is we need you to document the stage of the lymphedema, okay? Stage 0, which means we're at risk for developing lymphedema, but there's no signs or symptoms. So that's Johns Hopkins stage 1. Stage 1 is swelling that can come and go intermittently. Elevation can provide relief and some reduction, right? That's ISL stage 1. That is Johns Hopkins stage 2. If we have stage 2, we have skin changes, fibrosis, does not reduce well with elevation. We're starting to see a lot of that hyperkeratosis and that really fibrotic tissue texture changes. Remember that stage 2 is Johns Hopkins stage 3. All right. Stage 3 is significant skin changes, limb shape significantly altered due to the lymphedema. We have a lot of hyperkeratosis. We're oftentimes seeing that papillomatosis, things like that. Remember that this is Johns Hopkins stage 4. All right. So when you are staging, if you will just make sure that you mention the ISL stages, or if you're using the Johns Hopkins stages, that's just going to clarify for Medicare if that documentation has to get reviewed. Okay. Document the comorbidities associated with the lymphedema. So if we haven't necessarily done all of that, or we didn't have enough room to do all of that, sometimes when we're entering into medical records and things like that electronically, we might only have a couple spots for the ICD-10 codes. However, make sure that in our evaluation that we are going to really document the comorbidities associated with lymphedema: obesity, venous insufficiency, wound, cancer, all of that kind of stuff. And the reason is that we know that all of these create a really chronic lymphedema, right? We also know that, especially with obesity, that we're oftentimes dealing with limb shapes that are irregular, right? Or limb shapes that are not necessarily going to fall into a off-the-shelf type compression garment. So making sure that we document as many comorbidities that might be affecting that lymphedema as possible. And that's also going to substantiate the stage of the lymphedema as well, and the chronicity of that lymphedema. All right, so lymphedema presentation must be properly documented. You guys would be amazed. I've read way too many EOBs that were coming from DME companies who got denials. And a lot of what I read when I'm reading those denials is that, for starters, we don't have a good lymphedema diagnosis documented anywhere, right? Which we know now that has to happen. There's no staging, okay? And as far as the lymphedema presentation being well documented, there's very little proper documentation for lymphedema in a lot of what I'm reading, Okay, now these are denials. These are not the ones who went through with flying colors. So I know that a lot of you definitely do a great job with this. However, you've got to have the proper verbiage when we're dealing with lymphedema. Okay, fibrosis, right? We can have different stages of fibrosis, mild, moderate, severe. If there's that hyperkeratosis or that thick, crusty type tissue, also just that thickening of the skin that we see oftentimes with those latter stage 2 and stage 3 ISL stage 2, stage 3 patients, that thickening of the skin, that hyperpigmentation, right? So remember, it's not just discoloration or it's not just a red tint, right? We want to make sure that we're showing that that hyperpigmentation is coming from the lymphedema itself. Papillomatosis, those raised areas on the skin. And remember, it doesn't have to be just the huge wart-like developments that can come on the skin from those stage 3 lymphedema patients, but any of that raised tissue that we know is caused by the lymphedema, by the edema itself, is called papillomatosis as well. Remember, if we have any cuffing at the ankle, we see a lot of that with our lipo-type patients. But we also see this when we start to have some of that lobe formation in the lower leg. Definitely, if we have any lobe formation, we want to document where that lobe is. You know, we can have lobes on the dorsum of the foot. We can have lobes in the lower leg. We can have lobes upper in the upper leg, that medial thigh. So making sure that we're really documenting where that lobe formation is and the size of that lobe, right? Making sure that we explain the severity of those lobes when we are documenting that as well. If there's any kind of hyperplasia, so distension of those tissues, we want to make sure that, you know, if it's a unilateral leg or a bilateral leg, but there's a lot more hyperplasia on one leg than the other, making sure that we document all of that as well. If we have a positive stemmer sign on a foot, on a hand, we need to document that as well. That lipodermatosclerosis, right? That inverted champagne bottle. Make sure that we always document if you see that, okay? And the reason is most of those patients do not fit well in an off-the-shelf garment, right? That's almost an automatic for a custom compression garment, and why we would need that. Any kind of irregular limb shape. So sometimes this is because we have obesity, right? Sometimes it's just from like the lipodermatosclerosis, or maybe we've had a traumatic injury and we have a limb that has been disfigured from something along that line. And then every now and again, we have patients who are just more irregularly shaped, or what we would consider more irregularly shaped and not quite so truncal, okay? If we have any lymphorrhea or weeping, we want to make sure that we document that as well. That oftentimes shows the severity and the chronicity of our lymphedema as well. All right, so lymphedema measurements. Definitely need to take a lot of circumferential measurements. You can do other types of volumetry. However, the biggest thing that I see is that we forget to measure the trunk, the abdomen, the hips, okay? Make sure that we are measuring these areas and making sure that we're documenting the areas that might include the abdomen, the genital region, the breast and chest, and the trunk edema when we're documenting, okay? Remember, we're not just sticking to those limbs. We need to make sure that we're documenting the trunk as well. This is going to show if we have any increases in edema in these areas, if we have any reductions in these areas, but it's also going to help us better show that we do have lymphedema in those areas, right? So when we can show those increases, decreases, things like that, we want all of that well documented with those measurement, circumferential measurements as well. All right, we want to make sure that we're going to document function. So making sure that we're showing that our patients are limited in their function. So we want to be able to document ambulation and mobility, ADL function, including lower body dressing, endurance, range of motion, flexibility issues, All of this document and function is also going to help us with some of our donning aids. Okay. Sometimes it's going to show why we need something layered. If we need a layered compression garment because the patient can't get on to 130/40, maybe they can get on a 10 millimeter mercury and they can get on a 20/30 knee high over the top of it. Okay. All of this documentation and function is going to show us reasons why we might need some variants for our compression garments. Okay. Always going to make sure that we document the social and caregiver support. Does this patient need assistance for lymphedema management? Do they have anybody who can assist them for lymphedema management? Does this patient have family or caregiver at home who can assist if needed? Does this patient has outside family or friends who can assist consistently for home management? And we need to make sure that we consistently document that. There again, this is going to substantiate some of those donning and doffing aids. It might substantiate the reason why we're layering compression garments again. And remember that way we're not having to use a liner as one of our compression garments and then a knee high as a second compression garment. We want to be able to use that set as one, correct? So that we can make sure that we're advocating for our patient to be able to have as many of those compression garments so that they can have plenty to wear and wash as they should. Okay, but being able to document this social and caregiver support is going to be hugely important for all of that as well. Document the treatments in the home program. So we need to make sure that, we just didn't put somebody in a compression garment and not really process through the entire typical CDT for that patient. So if we're doing bandaging and exercise and MLD, skincare, and any kind of compression garments maybe that this patient has tried and failed in the past, or maybe a compression garment held him for a little while, but maybe it started failing, or maybe a patient tells you that, the leg just got so big that I couldn't stand it anymore, or I can't stand the fact that compression garment cords me at the ankle. Things like that, so that might substantiate the reason why we would need a custom compression garment versus an off-the-shelf, or maybe a flat neck compression garment versus the circular neck compression garment, all of those types of things. Prescription for items. All right, so there has to be a signed prescription by the physician, okay? Nurse practitioner, PA. This includes the bandaging supplies individually listed. We'll show you that on the next slide. And then each item must be listed as specifically as possible in the order, okay? So we want to have the type of garment, if we think that needs to be custom or if it can be off the shelf, the body part to be covered, and the grade of the compression or the class of the compression, okay? The order must be sent to the DME enrolled supplier with Medicare providing the items. Okay, so we're going to send that. The physician signs off on that order. Now, obviously, the DME company can also send off for all of that. But if you know specifically as a practitioner, this is what I know I want for my patient, right? And whether the DME company is going to be the one that is going to measure and fit for that garment, or it's going to be you that measures and fits for that garment, we still have to have all of those parts on that order in order for it to qualify to be reimbursed by Medicare. Okay, so the type of garment, if it's off the shelf versus custom, the body part to be covered, and the grade of compression. All right. Now, if we are getting some of our bandaging supplies and we want to get these from one of the DME companies, here is how we have to actually list each one of those out. Okay, so you actually have to have everything specified out. It can't just be a multi-layer short stretch bandaging system. We have to say exactly what bandages we're going to use. The physician signs off on it, and then we can send it in to that DME company. All right. Now, making sure that you understand that right now, Medicare is not reimbursing well for stockinette. Okay. Not reimbursing for stockinette. Haven't gotten any of the DME companies that I use as a practitioner to be able to pay for the stockinette. It's an issue. All right, we know it's an issue. There are also some of the companies that will not pay for the cotton padding, the CLT-LANA cotton padding. Okay, and then when they do, it's a really small little tiny piece of that. So the beautiful part is they are paying for like the Rosidol Soft, and they are paying for the Rosidol K, the short stretch bandages, pretty well on those. So if we are documenting specific need for bandaging supplies, this is where things get a little bit tricky, right? You have to make sure that you have some sort of verbiage in your documentation that specifies the need for multi-layer short stretch bandages, okay? So an example, a patient with late ISL stage 2 lymphedema, bilateral lower extremity, with moderate fibrosis and mild hyperkeratosis distally, with positive stemmer sign bilaterally that requires multi-layer short stretch bandaging toes to hip for lymphedema management. Bandaging supplies must be documented by the number of yards needed for the patient. I know, everything that we see is in meters, and then all of the sudden, and what we see on our boxes for our bandages is all coming in meters, right? And then Medicare comes in and says that they want everything converted to yards, okay? So what we can do is on that form from the doctor's office, we can actually say, we can actually quantify that and put the yards out beside it and then calculate up from there what that actual total yardage is going to be, right? So in my documentation, I can actually put that a patient might need a total of 110 yards of short stretch bandaging supplies for bilateral lower legs. So on that bandage order, what you're going to see is that there's 4 Rosidol Soft, 10 centimeter by 2.5 meters, which is a total of 10.9 yards. Okay. Or if you have short stretch, you've got 8 Rosidol K, 10 centimeters by 5 meters, and then 4 Ideal Bind, 15 centimeters by 5 meters, and the total is 65.6 yards. The good part is that we can stick it in our phones nowadays, and it can tell us what the, if you have so many meters, you can just put it in and ask it to tell you what the conversion from meters to yards is. Okay, hugely helpful. At least we're not trying to calculate it out ourselves, since most of us are not true mathematicians, and so we can stick that in our phone and still come up with the proper number of yards. Our documentation for that is a patient will require 10.9 yards of foam bandaging and 65.6 yards of short stretch bandages to manage the lymphedema from toes to groin, and multiple sizes and widths required to create the proper gradient compression. Okay. Although we do know that when we're billing out, when the DME companies are actually billing out, the foam is all under one code. The short stretch bandages is all under another code. But we do need to make sure that we're taking and specifying out the certain number for foam, the certain number for short stretch bandages. So documenting specific need for compression types. Here's another thing. So we need to make sure that we're very much clarifying why we need certain types of compression. Okay, why we need flatnet, why we need a custom. We need to make sure that we are justifying all of those things. Okay, so the need for custom compression garments, inelastic wraps, nighttime garments, layered garments, accessories must be documented individually. All right, individually. So you can't just say that the patient's going to require a custom or a flatnet of 2030, and that's going to cover everything else. It all has to be documented individually. So an example of this is that the patient requires custom flatnet 2030 compression thigh high due to moderate fibrosis, medial thigh lobe formation, morbid obesity with irregular limb shape. Okay, we just justified the reason why we might need that flatnet. In another example, a patient requires a tribute night low profile custom compression garment due to ISL stage 2 lymphedema with moderate fibrosis and moderate hyperplasia of the lower leg. Unique presentation with lipodermatosclerosis requiring custom made. Okay. Another example is patient requires a tribute wrap, which is not custom, nighttime garment due to ISL stage 2 lymphedema with mild fibrosis and lymph fluid refill overnight of the lower leg. Another example is patient requires a tribute night pull-up loop accessory for donning and doffing due to chronic back problems with surgery times 2 lower back and an inability to reach his feet. So what we are doing is we're justifying with that patient's presentation and with that patient's medical issues why we are going to need the items that we're going to need. Okay, we have to justify that, and that has to be done from our documentation. It has to be in our documentation, which is the reason that a lot of the time these DME companies now are asking us for our documentation before they will even order these compression garments, because if they don't have good documentation to substantiate the need for these compression garments, then if they get audited for that garment and they don't have the correct documentation to substantiate it, then Medicare can ask them for their money back, right? So you guys be careful. If you want to have a good relationship with your DME company, your documentation has to be really, really good. You know, and here's the hard part with this, you guys, is that I know that those of us that are clinicians, we don't necessarily get paid for these, right? We don't get paid for measuring these. We don't really get paid for fitting these. Sometimes there's some codes we can use to kind of finagle around that a little bit. But still, we're not the ones who make the money from this, correct? However, the way that I look at it is this, all right? Our patients cannot be our patients until we follow through with everything and make sure that the compression garments that they so desperately require that they can get. And the reason that they're going to be able to get those is with your documentation, okay? Very, very important. Medicare versus Advantage plans. All right, so Medicare should cover all of the items in this PowerPoint with comprehensive documentation that substantiates medical necessity. Many DME suppliers are requiring documentation be submitted with the actual orders themselves, okay? We know that a lot of the Medicare Advantage plans are implementing Medicare guidelines, but timing and requirements will vary, as well as the number of compression garments that that patient can receive. So I'm a little more hesitant to try to order my patient 3 garments with a Medicare Advantage plan, because sometimes they're not only wanting to reimburse it too. So you got to make sure that you're going to check with your DME provider to see if they are in network with the Advantage plan before informing your patient that their items could be covered. Okay. So remember, with those Advantage plans, there's so many different plans. There's so many different plans within each plan. Okay. So even though we've got a United Healthcare Medicare, right? Remember that there's different plans within that United Healthcare Medicare. So always check with that DME provider before you go tell your patient, oh yeah, your stuff is going to be covered with absolutely no problem. All right. The only one that we can say that with 100% certainty until we check with that DME company is that Medicare. Okay. That red, white, and blue Medicare card. Okay. That is the only one with certainty that we can tell them they're going to cover that at 80%. Okay. So items coverage we aren't sure about yet. We're trying this. Okay, so I know a lot of people ask me all the time the disposable bandaging systems, such as like the Rosidol TCS. So it's a dual layer system. It's got a soft layer, it's got a compressing layer over the top. And if we're using that just for the sole diagnosis of lymphedema, no wounds, right? Which is what we used that in the past for a good bit. We are now attempting to bill that as one of the Rosidol soft and one short stretch bandage, right? One Rosidol soft and one short stretch bandage. These 2 bandages combined will form a disposable dual layer system. Now we just have to see if the DME companies are going to be able to get high enough reimbursement to substantiate the use of that Rosidol TCS with the cost of the product versus what the reimbursement is going to be for that, okay? Before submitting, Remember to read your documentation to see if it answers the why. Why does this patient have lymphedema? Why do we need this particular compression garment? Why do we need this particular nighttime garment? Okay. Why does our patient need that donning aid or that lymph pad? Why do our patients need those things? Because if you can't answer the why in your documentation, then when Medicare asks why, that's going to fail the audit. Okay, it's going to fail the audit. Right. So what about other payers? Medicare Advantage, you know, they have to cover all medically necessary services that original Medicare covers. In many cases, you may need to get approval from your plan before it covers certain services or supplies that are associated with it. So are they going to have to cover lymphedema treatment? Yes. The supplies, that's all a little iffy. So just make sure they're coming around. Okay, right in the beginning of this year, we had a lot more holdups with the Medicare Advantage plans. Things are coming around pretty good. Just make sure that you check with your DME before you tell a patient that they're going to pay for those garments, and then how many of those that they're going to pay for as well. Okay, so with our other payers, how should I document? The same way you would for an original Medicare plan. Okay, so even before we had the LTA that got passed, I was already reviewing EOBs for DME companies who were getting denials on compression garments, particularly custom compression garments. And the biggest piece was documentation. Well, these are all the components that I'm teaching you today that really needed to be done then in order to fight those denials on those compression garments, okay? Just know that each state Medicaid and private payer plan, such as United, Blue Cross Blue Shield, Aetna, will implement their own policies and procedures. So always, always make sure that you find out from that payer first whether they're going to cover those supplies before you tell your patient that they are. Okay. I always tell my patients, even a patient who's got a Blue Cross Blue Shield plan, United Healthcare plan, an Aetna plan, you know, let me just make sure I check with my DME company first to make sure that we know that they're going to pay for those compression garments or even those bandages, things like that. Okay. So how should I document? You're going to follow guidance from the plan, but at least cover the basics: diagnosis, symptoms, duration, prognosis, why custom versus standard, etc. So all of the whys we still need to answer, even when we have other payers besides just Medicare. All right, so LNR has a wonderful link to tell you about the Lymphedema Treatment Act. You guys can follow this link. So they give you kind of some of the updates, the up and coming or the latest from the Lymphedema Treatment Act with that. There's also a LNR documentation tool. Beautiful, right? What an amazing resource for the tribute night and the tribute wrap. So you guys make sure that you scan that QR code right there, and it's going to give you more information about the things that you might need to document when we're especially putting any of the accessories on those compression garments. You know, the reason why we need those versus some of the other type nighttime garments, things like that, kind of gives you a little bit of that good verbiage to be able to use in your documentation as well. Here also is the LNR prescription pad. You guys remember that the prescription pads are going to save you a lot of time when it comes to writing out everything that you need to be in that compression garment, right? What the class of that compression garment, what body part it's on, if it's a daytime garment, a nighttime garment, and how often we're going to need that compression garment, okay? We need to make sure that all of those things are on those orders. This just kind of makes it super easy and make sure that the physician can still sign off on that order form. It goes straight to from the physician, send it to the DME company, and all the boxes are checked without us really having to stop and think about it, okay? So the USMCA, so the United States Medical Compression Alliance, was created prior to the final rule coming out for the LTA. They did fantastic work over the since 2022. I will tell you that in 2022, LNR USA stepped up our efforts by becoming a member of the USMCA, which is a coalition of medical compression device manufacturers. There are 5 manufacturers in that group. And the USMCA mission is to promote awareness of and access to medically necessary compression garments and bandaging supplies for lymphatic and venous disease. LNR is a USMCA Class A member, and they are very excited to help the USMCA fulfill its mission to support patients and providers across the United States. So wonderful work from the USMCA. I give kudos to them all of the time. I've had a wonderful time working with them, some as well. A great group of similar-minded people, all willing to come together. Even though they are they're competition for each other, but they all came together for one mission, and that's to support and provide for us and our patients throughout the United States. All right, next we have questions. Questions, concerns, write those questions in the chat, and we'll try to get to some of those.
Hi, Brandy. I have a few that I transcribed while you were talking, so I'm going to go in order in which they came in. First of all was from Jonathan Franklin. Jonathan asked about, what about coding if a patient has burns along with lymphedema? Any insight into that?
Yeah, so Jonathan, what you're going to do is just making sure that we still have the lymphedema code, but then we're going to come down behind that code and we're going to use the codes for those burns as well. So just like I was saying, that any of those lymphedema, other lymphedema acquired, so that I-89.0, remember it's acquired. So what created the lymphedema? So it was those burns that did that, right? So we definitely want to have the I-89.0, but we definitely need those burn codes underneath that as well. Good point.
Thank you, Brandy. The next question comes from TK Smith. They asked, is the Bjork bow tie test acceptable in documentation?
So the one thing is that the Bjork bow tie test, although it's one of my absolute favorites, did not show up in any of the written out for the LTA. Okay, so my suggestion is, yes, you can put your Bjork bow tie test in there, as long as we actually state what the Bjork bow tie test is, or if you have some verbiage that explains it a little bit. But also you can still use your stemmer sign as well.
Great, thanks, Randy. The next comes from Tammy Mondry. She asked, does a signed plan of care serve as a prescription if it has all of the detail?
If it has all of the details, yes, that signed plan of care could serve as a prescription. But remember that when you're handing that prescription to a DME company, just make sure that everything is nice and clear with that. But could that be? Yes. And do I do that sometimes, Tammy? Yeah, I do. Okay. I definitely do.
Thanks, Brandy. Whoops, sorry. My pad of paper hit my keys. So Kelly asks, Kelly Bayer, what kind of documentation does a patient need to obtain a new set of compression garments after they're discharged from therapy?
So the main thing is that a patient is going to continue to need that diagnosis from their physician. So their diagnosis of lymphedema is going to have to be steady with whoever the physician is that is signing off on those compression garments. Okay, so so if it's Dr. Smith, right? Dr. Smith has to make sure that in his clinical documentation for every time that he sees that patient, that he continues to use that same coding for lymphedema. Now, here's the hard part down the road, right? So I have a patient, they're coming to me in clinic, and I can document all of the issues that that patient is having for continued need for a certain kind of compression garment or a custom compression garment, right? So we still don't necessarily know how long my documentation is going to serve good for an audit, even if a patient gets these compression garments a year and a half from now, 2 years from now, 3 years from now. We're not that far down the road just yet. You know, I think it's going to depend on how well documented by the physician that says that the lymphedema is being well controlled by the current series of compression garments utilized by this patient. Something along that line. We're not really sure if a patient's going to have to come back to us every year, every 2 years, something like that. We're not really sure how that's going to work out just yet.
Thanks, Brandy. From Andrea, she asked about any insight or recommendation for documentation when they're treating lymphedema in a skilled nursing facility setting.
So skilled nursing facility settings are a little more tricky, right? And that's because they're under Medicare Part A, and the LTA completely rules under Medicare Part B. All right. So unless that patient is receiving any type of Part B services, so rehab within your facility, they're really not going to qualify for LTA benefits for compression garments, unfortunately. Okay. So the best thing I can tell you is that you just need to work with your skilled nursing facility, because technically those garments then have to be provided by that facility, or are supposed to be provided by that facility if the facility is willing to do it.
Thanks, Brandy. Rob Huffam asks, does Medicare pay for skilled measuring for garments? I'm going to make a quick comment, Rob. There is a subcommittee as part of the U.S. Medical Compression Alliance. We're working on coming up with a national standard and testing for people to become certified fitters beyond just a mastectomy fitter. But I don't know how that integrates with Medicare at all. Brandy, do you have any insight into that?
So, you know, right now, unfortunately, Medicare is not paying for, I'm an OT, you guys, they're not paying me to measure for a compression garment. Okay, there's verbiage in the LTA that says that DME companies should technically be possibly paying us to be able to measure for compression garments, but that's all very sticky, very Stark Law-ish. And so we have to be really careful there. So right now that is still in contingency as to if we as clinicians are measuring for those compression garments and why we are not being reimbursed for that time. Those questions are all being asked, and there are groups that are lobbying for that as well, for us to be able to be reimbursed for that. And as far as Bob says, you know, right now we know that there's DME companies, but just because that company is billing for that compression garment, does that necessarily make them suitable to be able to measure and fit for that compression garment? Not necessarily. So the USMCA and the BOC, we're all working. I'm part of a group on the BOC as well that are working on, with the BOC, we're working on an exam type thing that would make it so that those DME companies would have to be well trained to be able to measure and fit your compression garments with those patients with much more training than such as just a mastectomy fitter or something, or orthotics, something along that line. Okay, there again, we got a little bit of we need some work. We need some tweaking in that area. Definitely, if you're a PT, OT, reach out to the OTA, PTA, making sure that they're trying to lobby for you to be able to have a code for measuring compression garments as well. And whether that's a time code and, you know, 15-minute code, or whether that's a flat rate code, we just need something. We need something. As far as when I'm fitting a patient for a compression garment, a lot of the time I'm gonna use that ADL training or functional activity code to be able to train with that. And the reason I do that is because that's something that the patient's going to be using for a lifetime, right? That's a functional activity for them, is donning that compression garment, being able to take care of that compression garment, all of that kind of stuff. So fitting, a little easier to bill for. But as far as the actual measurement part, a little more tricky.
Thanks, Brandy. A couple of questions from Elaine English. Hi, Elaine. I know Elaine, she has a DME or two down in Florida. Elaine's first question was, please confirm that adjustable garments are considered as daytime garments and not nighttime garments.
They are, and they can be, but it needs to be documented. There again, if you're using an inelastic wrap, right, or an adjustable garment, and you're using it for daytime, you need to make sure that that's well documented. And yes, you can use that. I have. I've done it already this year. Okay. And I've used those as a daytime garment, and I've still gotten my patient a nighttime garment. But you need to document the reasons why you're going to use that as a daytime garment versus a nighttime garment, whether you need, the patient needs to be able to adjust it more frequently. The patient can don the garment a lot easier because of endurance issues, or the patient can don it better because of back type issues, anything along that line. And then you can still get a nighttime garment with that as well, but you just have to document really well that that was a daytime garment with those adjustable wraps. Okay.
And then as a follow-up question, Elaine asks, does the fitting of the garment should it be documented if the fitting of the garment is documented by the therapist if the DME is not fitting the patient? I'm sorry. Does the fitting of the garment be documented by the therapist if the DME is not fitting the patient? That would mean further documentation will be required. So I think she's talking about 2 sets of notes, probably, or something like that. So.
Yeah, obviously, if we as a clinician are going to fit that compression garment, then we need to make sure that we documented that we fit that compression garment. All right. And then the DME company needs to make sure that they documented that the therapist, and maybe even the therapist's name, fitted patient for the compression garment. Just kind of double checking that right there.
Okay, thanks, Brandy. And then this is kind of a follow-up from Sandy Perone. Do you find that including a picture of the patient can help to justify the need and better support your documentation?
Pictures are priceless. Yes, definitely pictures. And those pictures are probably going to stay right there. Nobody's really going to use them unless you get audited. Okay. So, but a picture's worth 1,000 words. Yes.
Great, thanks. And then Pam asked, and everybody, just so you know, we're answering questions from the chat, and then we're going to go to the Q&A. I know there's two separate sections that they're questions. And a number of you have asked for, are the slides going to be available, where the video is going to be available? We're going to put Brandy and Michael on at the end of the Q&A here in a few minutes. Michael is our creative lead and handles all of this, and he's going to tell us, they're going to tell us exactly where these are going to be available. So I'll get to everybody's, because I've gotten about 6 or 8 questions on that already. So Pam asks, do you know what accessories are covered? And I'm not sure accessories for what. I think it depends on the garment, but I'll let Brandy get into that in a second.
Yeah, so, Pam, we everything's been kind of sticky with the accessories on compression garments and things like that because the coating's kind of off a little bit. But if we know that we need a zipper, we need silicone in a different place or something like that with a custom compression garment accessories is what I'm assuming that you're saying, then make sure that you document why we need those parts, right? Why we need that zipper, why we need that extra silicone, things like that. If you're talking about accessories such as things like lymph pads, things like that, they're again just documenting why we need those things. Okay, there are codes for some stuff that is not, it leaves things kind of open-ended. Okay, so you have to find a DME company who's willing to try to really fight for adding those accessories in. The coding didn't do a fabulous job with adding some of those accessories in, but is it still possible with the proper documentation? Possibly, yeah.
Thanks, Brandy. And Pam added a follow-up, a clarification. She was asking about donning and doffing assistance too, and
Right, so donning and doffing aids, there again, just make sure that we're documenting exactly why that patient needs that donning and doffing aid. Their limitations, lack of caregiver support, those kind of things to make sure that we can get that patient a donning and doffing aid. Yes.
Yeah,
And they are paying for those, yes.
Sorry, Randy. Pam also asked about, is the LTA covering garment washes? Are you talking about a commercial washing of a garment like in a facility, Pam? Or
some of the garment manufacturing companies come out with the actual wash, like almost like a detergent for their compression garments. And
gotcha. Okay.
As far as I know, Pam, they are not covering any of that. No.
So when you say washes, Pam, you actually meant detergent. See, when you say wash, I think of the physical act of washing. Sorry about that. Okay.
I think that's what she means. I'm pretty sure.
Yeah, no, that's what she means. Definitely, she clarified. So, okay, good. So now I'm going to go. We've gotten through the chat questions. Now there's a few in Q&A. One is, will the PowerPoint be available? Okay, so here, Judy West asked, I frequently get orders that say I-89.0 lymphedema, eval, and treat, no additional comorbidity ICDs. Do you add that?
I do. And the way that I do that is that I just get the documentation from the physician's office. So the last note, or maybe the last few notes from that physician. And then as a clinician, right, I know the things that the diagnosis, the comorbidities that patient had that are going to exacerbate that lymphedema. You guys, I never take it and do an evaluation on a patient just based off of a basic order sheet that comes in, right? I always want notes on that patient. I want to review those notes before I ever even treat that patient so that I get a better idea of what is going on with that patient before they ever walk in my door. Okay. The other thing is then I can then go through those physicians' notes. And when I get their medical history, right, I can go down that medical history and I can figure out what other comorbidities are affecting that lymphedema before that patient ever even walks in. And then I can take that because the patient has already been diagnosed with those. I can turn around and I can use those to substantiate my I-89.0. Okay. So I'm using my clinical reasoning and my clinical judgment, but I did not diagnose, right? I just chose the diagnosis that I know exacerbate that lymphedema or have caused that lymphedema. Okay. But there again, you've got to have the physician's documentation in order to do that.
Thanks, Brandy. Okay. And then Meg asked, why is Medicare, who knows? No, anyway, why is Medicare not covering ReadyWrap Velcro wraps for I-89.0?
They are.
Yeah, that's what I thought. So
yeah, they are.
They are, Meg. So we're in good shape. Yeah. Some of this, just so everybody knows, and Brandy will confirm this and probably speak more eloquently to it than I can. But this is still evolving. I mean, we're only in the beginning of month 9 of this. And what's nice about working with MMS and PDAC and all the other agencies is that they're willing to, go back and review what's happening and look at adding things on. So if something's not covered this year, let's say, we might be working on getting it covered for next year. So some of the accessories that we talked about just a moment ago, for instance, if we have a minute at the end, I'm going to show you some of the new accessories we came out with for the tribute wrap head and neck. And right now those have a code, it's 6593, A6593, but right now they don't have a reimbursement rate yet. So that's where we're at with that. So I think we covered all the questions. The only one that we're going to cover as a group is the one about clinical web documentation. And Michael just put down that. Let me see. Somebody asked. Nicole asked us. Sorry, I'm getting a couple things coming in here pretty quickly.
That's okay.
Pardon me.
That's okay.
Let me just get back to this. Michael just posted on the chat, everybody, where the webinar will be available. We'll send a communication out to let you know. There's also a form that Liz Zinda, our new Associate Product Manager, just posted to request a LANA recertification certificate. Please fill out the following form. So that's also in the chat. And then, Brandy, one more question from Nicole. Does straight Medicare cover multiple reduction kits?
Nicole, I have not had any success with multiple reduction kits. No, not yet.
Okay.
Not yet. There again, another.
Yeah, and Nicole says that she has not either. So,
yeah.
So I'm going to zoom through just a couple of things here real quickly, everybody. We've got some new line extensions in the Tribute Wrap line, both a bra that is covered under the A6528 code, and then I think most of you know about our Tribute Wrap head and neck that came out in 2023, and now we have a bunch of accessories. Next slide, please. Brandy, I think yeah, good. Okay, so here's the sizing on the bra. And as I said, it's a very favorable code, the A6528. So DMEs are on board with this already. So if you haven't seen this garment, you can see it's got a lot of adjustability to it, both across the shoulders, which we put in all of our upper extremity garment, or our vests and so forth for anything having to do with the chest. But then you can see there's a lot of adjustability around the sides. You can customize it. So even for a standard size product, you can customize it for asymmetry in the bust line and so forth, depending on what surgery or asymmetries there are. Next slide, please. Okay, here's just showing some of the adjustability, angled straps, and the zipper, and the crew neck, yep, good. Okay, and then for the head and neck, we came out with all these wonderful accessories. So you can customize around the cheek, and they're left-right specific. There's an eye patch, there's a lip bridge, and there are some longer cross or straight compression straps that can be used to semi-customize the garment. So, and right now, even though, as I mentioned, the 6593 code is there, the reimbursement is not there yet, but these are very affordable accessories to really make the garment a lot easier to use. So, and then Brandy, I think there's just a couple of photos. You can move through those pretty quickly. Here's the cross straps that you can either use across the lip bridge or the nose. Next one is just the cheek pad, and that can be used either left or right in conjunction with the cross compression strap. Next one, please. The eye patch, either left or right. And I think there might be one more. Yeah, the lip bridge pad. Oh, that's right. Okay. We brought all these out at once. So, and then the straps, I have a little bit of elastic in the center and then Velcro. Each garment comes with two shorter straps. If you get one with a trach notch, you can use those to close up the trach notch or to semi-customize, but these are just longer ones that you can really use to make the garment almost a full custom product. So, all right. Thanks, Brandy.
Thank you.
Looks like we're just rolling into 11. Well, I'm in Central, so 11:59. Any last questions? A couple came in. Danielle wrote, are they covering compression bras and swell spots for breast cancer?
Yes, they are.
Yeah, good. And Sandy wrote, so if a new order comes in for a patient with an edema diagnosis, you would immediately request a new order with a lymphedema diagnosis?
Yes. So if I get a patient and that comes in bilateral lower leg edema, R60.0 is the code they put on it, right? What I do is that really you can write up something that's already pre-written and just explain the Lymphedema Treatment Act and that you have to have the proper lymphedema coding in order to get your patients the supplies and garments that they're going to need for the treatment, and ask them to put one of the proper codes on there. Okay. I've been doing this for years anyway, just to make sure that we're using the proper lymphedema codes, but this gives you a lot more incentive. We're going to find over the next few years when they come out with the stats for the number of lymphedema patients in the United States, it's going to be significantly higher than what we've seen in the past. And not because that there's really that many more lymphedema patients, but because they're going to be properly diagnosed from now on because of the LTA.
And then Amanda Hartley got one last question. Are truncal garments covered?
Truncal, yes. Make sure that we document why we need that. That's the reason we want those truncal measurements. We want to document any kind of fibrosis, pitting, And then making sure that we also are documenting any kind of obesity or irregular shape to that truncal region for those compression garments as well. But yes, they are.
Wonderful. So we're right at an hour. So thank you, everybody. Thank you, Brandy. Yep, good timing. Thanks to Liz, as I mentioned, and Michael for coming up with this, Brandy for running this very informative seminar. As we mentioned, it is going to be available. Some of you asked if the slides are available. I don't know if we normally put up a separate PowerPoint slide deck. I think you'll have to watch the video, if I'm not mistaken. If I am mistaken, please correct me. Otherwise, thanks again, everybody. Please reach out to your L&R rep if you know who that is to get samples, or if you want to just write to us at the general email at L&R, it will be forwarded to the correct rep, and then you can have time to answer more questions with a rep, have an in-person visit, get some samples, and so forth. So thanks again, everybody. Good luck. Keep fighting the good fight.
That's right.
See you at a conference soon, I hope. Bye-bye.
Thank you, everyone.